this is a very difficult time around the entire planet. COVID-19 is nothing like we've ever experienced. But as one of my mentors said to me years ago, and it resonates with me every single day, amidst great chaos presents great opportunity.
Hello everyone and welcome to a whole new episode of Engati CX. I am your host Drishti and today you folks are in for a treat. We have got a TEDx speaker with us on the show today. But before I introduce you to our guest, allow me to introduce you to the magic of Engati. Engati is the world's leading multilingual no-code chatbot platform, available across 14 channels with 35,000 bots created across 186 countries in every domain and use case. Engati has also been recognized as a top platform by INC.com, Tech World, CIO, and many others. We run the Engati blog, video channel, and the podcast, receiving upwards of 400,000 visitors annually. And now for our guest. Mike is a health tech entrepreneur and the president of Catalyst HTI. Mike developed the industry integrator concept, a new feature of the innovation economy that allows the healthcare industry to be integrated at the point of innovation by physically housing an entire ecosystem in a single location at Catalyst. In their 180,000 square foot industry integrator, it houses 60 plus health tech startups, academic institutions, healthcare system, and Fortune 100s alike in the race to fix healthcare. In partnership with government, non-profit, and commercial organizations, Mike and his team built Catalyst, first of its kind industry integrator in the Denver's River North district that houses the startups and the systems above. So Catalyst has opened its door in July 2018. And that's about our guest. So hi, Mike. We are really happy to have you on Engati.
Drishti, it's great to be here today, and I'm looking forward to our conversation.
Definitely, same here. So would like to begin with the first question that I have for you, that as the pandemic is going on, we've heard the terms health tech and telehealth being used around. So how do you think health tech has evolved since the pandemic started?
Well, it's a great question. And of course, when you take that question and then you couple it with the pandemic and COVID-19 and how it has changed pretty much every aspect of our life, telehealth and health technology has really now arrived. There has been many years there have been a lot of startups, a lot of entrepreneurs and innovators working to build novel technologies and solutions to help with reimagining healthcare, especially here in the United States, with an industry that is healthcare, that is over 20% of our nation's GDP, over a $3 trillion, that's with a T, $3 trillion annual spend and growing. And so for many years, there have been technologists just like myself and others that I work with that have been building these technologies, and now we have, quote unquote, arrived. The pandemic, COVID-19, has shown the desperate need for new technologies to meet the member or meet the patient or the consumer at the point of care. Where is the point of care at this current time, especially during a pandemic where we have to be socially distant? Typically, that point of care can be at the consumer's home, within their confined in their own bedroom at times, physically away and distant from other people in order to stop the spread of this pandemic. So with that, we here in the United States specifically, we have seen an enormous explosion in health technology, wearable technology, telehealth, remote diagnostic monitoring, chatbots, digital front doors, digital therapeutics. So those technologies are really helping to bring care to the point of where the patient needs it. And typically, as we speak, that's in their home setting.
That's great, actually. I think that was the need of the hour even before the pandemic came in. But I guess this pandemic has accelerated all these requirements and made it a necessity than just a want.
Yeah, it used to be a nice to have. It used to be, some of our patients have requested a telehealth visit, or some of our patients would like a wearable technology to monitor their heart condition or their diabetes, whatever it might be. But now it's necessary. Now it's mandated because of the environment that we're living in.
So where do you think the future of health tech is heading towards, and what kinds of trends do you see emerging in health tech?
Yeah, I mean, it's a big question because, again, as I mentioned, just in the United States alone, we're looking at over $1 trillion annual spend. We're looking at an industry now globally that touches every single one of us. Healthcare, health, and wellness, that touches every human being on the planet. So there's a lot of opportunity. Before I answer where I see things heading for the industry, I want to look at other industries and also give a historical look at healthcare, and then we'll go from there. If you look at other industries where technology and innovation has come in and disrupted, you know that it's coming to healthcare. If you're an executive in this industry and you don't believe that it is, you have your head buried in the sand, and this tidal wave of innovation, technology, and disruption is coming, whether you like it or not. For example, in banking, in finance, we've seen a huge explosion within the fintech space. I know you and your organization have done a lot of work within that sector, right? Education has been completely disrupted and fundamentally reimagined. We now have people in the middle of Africa in a remote village. If they have an internet connection, they can access educational content, whether it be to learn how to program software, how to learn new skills, right, through Udemy or whatever it might be. These types of technologies, these types of innovations, these types of ways of thinking are coming to healthcare again, whether the established healthcare industry likes it or not. And why do I say that? I specifically and intentionally say that about the American healthcare system. This way of it's always been done this way has been very lucrative for a lot of the incumbent and established healthcare industry players. Those days are numbered. Younger generations specifically, think of the millennials and younger. What did they grow up with? They grew up with a cell phone and connected technology in their hand as a child. This is part of their experience. This is who they are. They're used to hitting a button and your taxi or your Uber pulls up in a matter of moments. They're used to having on demand with, food ordering services or otherwise. These are the new normals. These are the normals for the younger generations. And in our country, the millennials is one of the biggest blocks of population for our country. And this industry better wake up and recognize technology, innovation, connected self. These are the new ways of healthcare and how it should and must and will be delivered. Again, whether the incumbent industry likes it or not. And so when you think about that, you look at other industries, you look at where we've been in healthcare and how it's always been this brick and mortar. I have to go and see the doctor. I have to go and see the nurse. Those are being flipped upside down. The information that is at the hand of the consumer or the patient is at an all-time high and growing rapidly. So these new ways of doing, of delivering care, receiving care, all of it's being changed rapidly. And some of it's being changed like we don't even know yet. We can't even really predict at this moment. But it's moving fast, and it will continue to do so because of what the younger generations demand and expect out of their experience when delivering health care and wellness.
Yeah. And also, I think that with the younger generation, there is like now in the pandemic, like people, even the older generation have started using these services, and now they know what the comfort is, and they expect these services to be implemented in other sectors as well.
Well, and it's a great point, Drishti, because if you think about it, change is hard, right? Change, no matter who you are, no matter what age, change is difficult.
Yeah.
And there's always been this, what I believe is a false reality that older generations, right here we call them baby boomers, these older generations, they don't know how to use technology. They're scared of it. They're not used to it. I don't believe that. I think your point is exactly spot on. Now that they're mandated to use it, that they have to use it, and then of course it's up to the entrepreneur, it's up to the startup, it's up to the company, whoever's building that technology. Always keep the end user in mind, right, in regards to how you build it. And if we build simple, UI interfaces for them or elegant ways that they engage with technology, it is amazing the uptick of consumption and usability of those technologies with those older generations. So I don't subscribe to older generations don't know how to use technology. I actually think it's lazy. I think that the technologist, I think the entrepreneur or the technology company needs to keep the end user in mind and build for that experience of what that end user needs. It's just a lazy answer. I believe older generations are very competent and very capable. We just have to meet them where they're at. But again, to your point, Drishti, yes, because we have to deliver care in new ways and new modalities, it has been amazing to see the uptick with the older generations using these platforms and using these technologies. For me, I find it very encouraging.
Yeah, it is. It is. Truly. So, how do you think that hospitals or care centers can implement this technology, and how can it benefit them?
Well, that's a great question, right? And again, the pandemic has laid bare a lot of the inequities in healthcare, a lot of the disparities, and a lot of the brokenness. It's showing it in real time. Social determinants health, public health, being able to deliver care affordably and consistently. And so I think we're still learning rapidly. Every day is new. I actually cover this on my podcast, The Passionate Pioneers with Mike Biselli. We talk to other healthcare executives and innovators that are deciphering what it's like to live in this new world that is the pandemic. And we have these conversations of what is it going to be? Me personally, if I had to look into that crystal ball, I think there's a lot of great opportunity on the administrative side of healthcare. Again, as I mentioned earlier, there's a $3 trillion annual spend for the American healthcare industry. One of those $3 trillion is administrative waste. Let me say that one more time because that's powerful. One of the $3 trillion every year spent in the United States of America and growing is $1 trillion of administrative waste. If I'm an entrepreneur, if I'm a disruptor, if I'm a technologist or a company looking at the opportunities within healthcare, that's where I would immediately go. Now, more importantly, again, when you couple that with COVID-19 and this pandemic, that's even more of a need because these hospitals have lost significant revenue because they aren't allowed to do elective surgeries during this crisis. A lot of the resources for PPE or personal protective equipment or otherwise, as well as staff and the actual hospital beds within those health systems, those are being dedicated to these very sick patients that have contracted COVID-19. So we've seen a big decline in elective surgeries. Think of a total knee replacement. Think of a spinal fusion, right? Things like that can be pushed off. That has then now greatly decreased revenues for health systems. So where do they make it up? Go and extract the waste, that $1 trillion spend, find some opportunities to extract waste out of the system so we're not wasting that money because, again, revenues have been on such a decline. So from my perspective, where I see huge opportunity even now and moving forward is really tackling that $1 trillion annual administrative waste. Of course, I can talk about the clinical aspects of technology and where things are happening there. But for me, that's where I get very excited and very bullish of where the opportunities lie ahead for all of us thinking about reimagining healthcare.
That's actually a good point. Like where you know that the big fish is, maybe you should try attacking that. Totally makes sense, yeah.
Well, and also think about it as well, Drishti. I mean, clinicians, providers, doctors, nurses, nurse practitioners, the frontline staff that are delivering care to patients right now, the statistics prove it. Burnout is at an all-time high, right? Mental well-being and mental health for them is a very important topic right now. These care providers are maxed to the very nth degree, especially given COVID-19. It's an absolute epidemic within the pandemic. Mental health, mental well-being, taking care of oneself. And so why do I share that? The last thing that we should be doing as technologists and innovators and disruptors is adding one more piece of their clinical workflow as they're trying to focus on that very, very important and very intimate patient to provider encounter. That we need to always keep top of mind. And from my perspective, what I think we should all be thinking about is how do we put technology, when you're thinking about clinical technology, in the background? So the provider, again, the doctor, the nurse practitioner, the medical assistant can get back to that very important encounter that is between the provider and the patient. And so we need to stop thinking about adding one more button to the clinical workflow, one more click here, or one more piece of technology there. We need to be able to get technology and innovation in the background to get back to that very intimate setting of patient-provider interaction.
That's really true. It is a concern, and this is something we should be focusing on. So how do you think that on-prem chatbots can play a role in dealing with the sensitive data that is between the doctors or the providers or the patients that gets collected? And how can it be used to interact with these patients?
Well, first, let's start on the security and sensitivity of the data, right? That's the first and foremost part that we should be thinking about as technologists and innovators. That is of utmost importance, right? PHI, or personal health information, is very sensitive data and should be treated as such. And so when we think through building technology and within your question, Drishti, around chatbots, we need to create, at least in the United States, a HIPAA compliant environment. There also may be some GDPR needs as well. We should always have that security top of mind and at the forefront of any technology that we build. Now, when we're thinking about also hooking into on-prem systems or anything that health center or hospital system is using, we need to keep those workflows in mind as well. But I believe that there's huge opportunity, right? Again, where's a lot of our time spent as a patient, as a consumer, with our cell phone, with our smartphone in our hand. It's in our pocket. It goes with us wherever we go, right? So these ways to interact with chatbots, again, digital front doors, digital therapeutics, digital companions for the patient, so the healthcare system, the health entity can engage with those patients, is a powerful one. And whether it be AI-powered chatbots, and then whether it be telehealth consults with the real-life person, all of that is very important and very needed and timely, especially with COVID-19. But we always have to keep security at front of mind, and you better have a strong case as to why your technology meets those demands when you go and present or when you're going and working with these healthcare systems and entities. Because if you can't meet that very basic check mark to deliver on those needs, you're not going to have a fighting chance anywhere else.
Yeah, that's really true. With the sensitivity of the data, when you talk about, so there are HIPAA compliances and GDPR also in place, but then there's also something where people would want to store the data on their end and have the whole data control, and that is where on-premise chatbots would play a really good role, where they can have the whole system to their in their control or in their environment. Yeah, so.
Well, absolutely, and there's also new and cutting edge ways as well to still create that, and thinking about maybe blockchain capabilities enablement. Right, we're seeing that really starting to take hold within healthcare. But to your point, still folks are still even having a blended on-prem cloud environment. Some are moving to the cloud. It is a slow uptick, but there still is a lot of on-prem, and that's great. But how do we create those secure mechanisms as innovators, technologists, and technology companies to meet the demands or the needs of the end user, which is, of course, one, the healthcare institution or system, which then, of course, is then two, the members that they serve. And that could be, again, the provider, the doctor, or the patient, or anybody in between. Anybody that's touching that very sensitive data, we always have to keep security top of mind.
Are there any other thoughts that you would like to leave with the audience concluding this interview?
Well, Drishti, I appreciate the open-ended question. And yes, I think we as leaders within healthcare need to think of new. This is a very difficult time around the entire planet. COVID-19 is nothing like we've ever experienced. But as one of my mentors said to me years ago, and it resonates with me every single day, amidst great chaos presents great opportunity. Sure, there is a lot of despair right now, a lot of old business models that were very successful just months ago have been completely torn down or are now inadequate and antiquated. But that, again, lies the opportunity to think anew, create new opportunities and models to help address where we are with COVID-19 and then beyond. Even after we get through this crisis in the next coming years, the world will not go back like it used to be, right? Again, as we've talked about earlier, telehealth, telemedicine, wearable technology, the connected patient. Those are going to be new realities and on a much broader scale than we ever seen before, thanks to the pandemic. So I always, share with my audience is take this opportunity of this chaos and what seems to be despair and look at it as an opportunity for a phoenix to rise from the ashes. And how are you going to help that phoenix rise? Because there is great opportunity to create new ideas, new processes, technologies, and innovation, as long as we look at the opportunity that is in front of us and think anew.
That's so true. And we empathize and understand that what people are going through, but currently what is needed is to survive and make it through whatever is there, and then maybe in the coming years you can go back to what you were. So absolutely true.
Yeah, and of course, with your amazing audience around the world, I'd love to hear from them. You can find me at Twitter, on Twitter at Mike Biselli. Search Mike Biselli on LinkedIn, or come and join our podcast. It's a nationally ranked healthcare innovation podcast and part of the exclusive Health Podcast Network. Simply search Passionate Pioneers with Mike Biselli in your favorite podcast player, and you'll be able to find us. We've been having some fascinating conversations around COVID-19, new technologies and innovation in healthcare, and we look forward to your audience joining us as well as we continue to think anew during these very unprecedented times.
Yeah, I am looking forward to people joining in, because it is interesting to see what experts are thinking about. So thank you for sharing that, Mike.
Absolutely. And thanks again for having me here today to spend time with you and to spend time with your community around the world. We have got to continue to come together to reimagine the health of our world. And now is more important than ever. And I look forward to being involved in everything that you guys are doing and the community that you have built as well.
Yeah. Thank you so much, Mike, for giving us your time, the insights, and the motivation that you have shared with us. It is really valuable, and the audience will really enjoy this interview. Thank you so much.
Well, thank you, Drishti. It was great to be with you today.
Yeah, thank you.